Hello. So last week we talked about grief and really framing it as a very normal life experience, albeit a very difficult and painful one most of the time. This week we want to look more at the experience of grief at loss. What does that look like? What are common effects that we can see? We remember, of course, that grief can be a very subjective experience, but there can be very common kind of signs and symptoms, and that's what we're going to talk about. Of course, the reading today comes from Grief Counseling and Grief Therapy, 5th edition by J. William Worden. I would say this is a really great book if you are someone who plans to do grief work, if you're going to be a counselor, do any kind of clinical work in any way. I think it is a great pickup, but I have just copied the chapter and put it in the module for you. So let's begin. In the chapter, Worden starts out by talking about the importance of understanding attachment and the role that that plays in life and the grieving experience. John Bowlby is one of the great fathers of this theory, and a lot of his work was looking at children and seeing how they responded to their mothers in various ways when their mother left and the kind of distress that they would experience, and beginning to kind of look at and analyze how humans, and in fact also other mammals, have a really kind of innate need to attach to others. And it's not always just for food, it's not always just for physical security. There's also something kind of that just serves an emotional value to us, that we want to be emotionally connected. We want to be connected to others. And I would also say something I think about a lot is when I think about grief and grief experiences that go beyond bereavement, I think it's also important that we feel kind of attached and connected to ourselves. I think attachment is a really useful lens that I think a lot as a counselor and a supervisor. Attachment says a lot about the way that we go through the world, and can we safely connect with others? Can we also safely kind of securely connect to ourselves? And so again, this need for attachment endures throughout the life cycle. There's a lot that happens in childhood that can do a lot to kind of form our attachment styles, but that kind of goes on throughout the life cycle. And how this connects to grief, again, we talked about real powerful grief comes when we lose someone or something in our lives that we were really connected to, that really informed who we were, that we felt very strong bonds towards. And the greater that bond, the greater the loss response when it is taken away or when something changes. And of course, Bowlby, looking at young children, would notice that young children, when their parents were taken away, they would be clinging, crying, they might get angry. And we can sometimes see that kind of same reaction in people across the lifespan. When they experience a significant loss, there can be this feeling of being angry that you've lost something that is very important to you. This is also something that we see, as I said, in other mammals. We'd read about and talked about that sometimes dolphins, for example, when they may lose a family member in their pod, or particularly children, young dolphins, they may try to keep that body with them. The other dolphins may help move that body along and keep that dead body with them. I was not going to put a picture of that up because that's just a little bit too grisly for here. But here's another example. Taken from the National Wildlife Federation. They did an article on when animals grieve, and these are some baboons that are grooming one another more often than usual, more often than necessary after the death of a companion as a stress response. So even again, seeing that the sense of attachment, of connection, and feeling a great amount of sorrow and grief when we lose someone that's important to us, we can even see that in the animal world, and we of course are also animals, humans that we be. There's another quote that I particularly like that kind of gets to this connection between attachment and the pain that follows in a loss. And this is by Dr. Colin Murray Parks, although parts of this are sometimes credited to the late Queen Elizabeth. The pain of grief is just as much part of life as the joy of love. It is perhaps the price we pay for love, the cost of commitment. To ignore this fact or to pretend that it is not so is to put on emotional blinkers, which leave us unprepared for the losses that will inevitably occur in our own lives, and unprepared to help others cope with losses in theirs. Another part of this discussion is understanding, and something I want us to wrestle with this semester, is we know that grief is a natural experience, but is it ever a disease? At what point does it become something at which we should intervene? At what point does that pain become so powerful that we might want to treat it much like other types of injuries that we experience in our bodies or other types of mental health disorders. So these are important questions. It's quite a complicated topic and something that has been debated by all kinds of mental health professionals for decades. But of course, we know that grief can significantly impact our emotional, cognitive, physiological, social, and functional well-being. It can change the way that we show up and live our lives. It is a natural part of life, of course. It is something that's going to happen. We also want to ask, what role does healing have in the grief process? What does that look like? What does that mean when we talk about healing? Again, can we think about it the same way as we think about an injury that might heal and that person might be restored to how they were before? And so this is something that Worden is very picky about. He prefers the term adaptation to loss rather than restoration or recovery from loss. Again, why are those semantics more important? They may or may not be in different situations, but I think what Worden is getting at is that we can adapt to losses. We can find a new normal. It may not always be that we can recover just as we were before, that there's some part of grief that involves some kind of intrinsic change. And again, I think that makes sense if we think about the fact that strong grief reactions are to things that were kind of a part of us, people, things, parts of ourselves that really informed our narrative of who we are. When that is gone, are we going to be the same as before? I'm not sure. I'm not sure we can be. But that can be okay too. Change is normal. He also talks about, again, this is more a lot of his writing, and a lot of the grief theories we're going to look at are going to be more attuned to losses when there has been the loss of a person, when there has been a death. And so he defines mourning, which is that process that one goes through in adapting to the death of a person. So that kind of outward behavioral process that we might be able to see. And bereavement is something that, again, defines a loss when it is relating to the loss of having lost someone that is close to you. So let's get into, again, knowing that there are some really powerful effects that come with grief. What do those look like just sort of generally? So here are some of the common emotional responses to loss. The first is sadness. That can be a very common one, and I think it can be culturally tricky because on one hand, sadness can almost be expected when people die. When we lose things, we can expect that people are going to cry, but people don't always cry, and they think, like, am I grieving correctly? I'm not crying enough. So, and sadness can also be quite a vulnerable emotion, whereas anger can kind of be an emotion where you feel a little more powerful. It feels a little bit more like a protective barrier, where sadness can be a very vulnerable feeling. So it can be an emotion that people can really struggle to go to, but a lot of people who do grief work will also often try to facilitate people getting in touch with that sadness in a safe place where they can feel comfortable doing that, because it can be quite helpful to process those deep feelings of sadness. And, a lot of people, as I said, will fear sad reactions and try to stuff them. So we do generally kind of think in grief work that expressing sadness is going to be helpful at some point. I said anger can be a really common grief response, whether that's, that can often mean feeling angry at the person they lost, angry at situations that could have contributed to the loss, angry at factors that contributed to the loss. Anger, it is a very active emotion, and sometimes in a loss, people want to feel emboldened and empowered, and anger can do that. You might not always find the answers that you're looking for. These emotions might not lead to resolution, but anger can be very present. And again, also a frustration, the lack of control over the loss is a common thing. We can just feel angry that something was taken from us and we weren't ready for it to go. And there can also be those feelings of helplessness that come in as we realize that we're not often able to change, that we have lost something. Blame is another common one, and I find this very interesting. I think especially soon after a loss, I've noticed this with clients, with students, with my clinical interns who are working with clients, with friends. People often, when there's a loss, they want there to be a reason. They want something to blame, and they feel emotionally like it's going to help you to find an answer or to find who or what is responsible for this loss. And again, that can turn to sometimes blaming the person that they lost, or blaming people involved in the situation with the loss, if that's a non-death loss. Sometimes that can also look like blaming themselves. And of course, there are going to be different amounts of situations where that is a rational response or not, whether or not, that person played a part in the loss, whether you contributed to the loss in some way that you're experiencing. and it's not going to change what has happened. But nevertheless, those are some common sort of immediate reactions, and particularly you want to pay attention to self-blame, and that can really escalate to feelings of guilt and self-reproach. If I had done better, this loss wouldn't have happened, and that is very normal. But when you see that continuing for like a year on, for a long period of time, and it's really impairing the way that they live life, that's when you might want to start paying attention to it and seeing if that person may benefit from kind of additional specified grief treatment. Anxiety. Obviously, this can range. It's going to depend on the type of loss, from light anxiety to panic, particular types of anxiety. Attachment-related anxiety is going to be very common in the loss of parents and partners. And what do I mean by that? You've suddenly lost someone that takes care of you, if you've lost a relationship, if whether you've lost a relationship to death or just, a breakup, some kind of separation, there can be a sense of, how am I gonna take care of myself? How am I gonna live my life the way that I used to? I think about, I've been married now for, about a decade, and if my husband were to leave, if we were to break up, or if he were to die, there's a lot of things I wouldn't know how to do because I've just become so used to our patterns of life. So that kind of attachment-related anxiety can be quite common. How am I going to handle life tasks, etc. There can also be anxieties that can develop into phobias relating to factors that led to the loss. Was this a disease? Was this an accident? Are there relational behaviors that were really scary? Was there, all sorts of things? Were there mistakes that I made? But people can become very fixated on the thing that caused the loss and then become quite afraid of that. And that can be very common, again, with things like diseases or accidents or traumatic losses. You're not only dealing with the grief, but then being quite afraid of the thing that caused the loss in itself, if it was some kind of violent act, etc. Loneliness, this can be very common feeling expressed by bereavement survivors, but really across many types of grief. Going through a grief experience can be very isolating. It can be very lonely. You can feel so much pain and feel like others can't understand or connect. Other people are walking around in a different world where they have not just experienced a severe loss. And if you are sitting with those feelings, if you've had a recent loss, you can feel very isolated and like other people are not on the same wavelength. Fatigue, which I think is also kind of can manifest physically and also manifest emotionally. You can feel very apathetic because there's so much energy that's going into these feelings. You can have so many chemical reactions happening in your brain and body that it is literally quite exhausting. So you can feel apathetic, listless. It can be just really hard to care about other things when you're really experiencing grief. It can be hard to be connected to your daily life. And this can feel surprising and distressing to individuals experiencing loss. It can make it harder to complete required tasks. And again, I think about someone who, if someone were to die and it was a close family member, and if you have to plan the funeral, it's just a very challenging place to be. When you suddenly, or you lose a job and then you have to kind of go out and find another job, and you lost the job that you loved so much and you're grieving, but it's like hard to get the energy to go back out. The end of a relationship. Are you going to go back out and date again? So loss comes with these feelings of fatigue that can be normal, but can also be quite debilitating at times. Shock can be a common experience, and it can kind of go along with numbness. But when you have a sudden loss, if you have a sudden death, or a loss that comes quite suddenly, you can feel a strong sense of disbelief, or like if it doesn't really make sense, reality isn't real, reality doesn't matter. You can just feel kind of overwhelmed. I know that I've experienced shock a few times in my life, and it can be very, very powerful. You can just kind of feel out of it and just feel almost like you're dissociating. So some of that can be extremely common. Again, if that's lasting months and months and months, that can become an issue, but people having strong experience of shock can be quite normal. And again, numbness, that some individuals may report feeling nothing after a loss, just feeling numb, because there's so many feelings to deal with that sometimes it can just be easier to protect yourself from that flood of feelings through numbness. And I would also say this is not, often it's not a conscious feeling. Our brains are quite capable of making choices that we're not consciously aware of and may decide like this, you're not ready to feel all these emotions, so you're just going to feel numb. I think sometimes others may feel like if someone is numb that they're just, choosing to be that way, but numbness can be a very common reaction, and it also can be adaptive sometimes. We're going to look at some grief models in the next coming weeks, and there is a certain amount of, if not numbness, a certain amount of avoidance that is going to be necessary sometimes through the grief process. Sometimes you need to feel those extreme feelings, and sometimes your brain and body and heart just need a break. So again, numbness, it is not considered an unhealthy reaction, again, unless that individual never progresses towards other feelings. Numbness can serve a purpose, but you also want to be able to experience those other strong feelings of anger, sadness, etc. And of course, emotional yearning, pining for what is lost, having those moments of just wanting that lost object back, missing the comfort, missing the familiarity, that can be quite common. Another sort of, I think, complicated or nuanced set of emotional reactions that people can have to loss are a sense of relief and emancipation. That sometimes we may lose something or we may lose someone where there are feelings of sadness, there may be feelings of yearning, but there can also be relief. Let's say that you lose, a parent. I'm thinking about, there was a book that was published in the last year or two by someone who was a child star. I think her name was Jeanette McCurdy, and she wrote a book, I'm like so glad that my mom died, or something along that title. And her mother was abusive to her growing up and would often encourage her to have body image issues, to like force her to be an actress, and so was very controlling, very manipulative. So we can imagine that if you were to lose a parent like that, you may have feelings of sadness, but there can also be feelings of relief. And people can feel quite complicated about those types of feelings, that when they, again, we talked about breaking up in a relationship that maybe did need to break up, but maybe there was a lot of, toxicity, maybe there was abuse in some way. You can still grieve and miss parts of that person, parts of that relationship, parts of that thing that were meaningful to you, and also be glad to let go of the pieces that were heavy, that were hard, that were painful. So again, guilt can sometimes follow if people feel any amount of relief. And I think that's okay. I think those might be things that if you're doing grief work that you want to help people process, that it's okay if it's complicated. It's okay if grief symptoms, grief experiences are a mixed bag. Cognitive responses to grief and loss, again, differentiating that from just kind of the floods of emotions. What are some of the ways that our thinking can change? Again, confusion. It can be really normal to be confused after a loss because your reality has literally shifted. It can feel very confusing, like a crazy maze. And it's, again, normal that people want to try and make sense of a loss experience. At the same time, there are a lot of things where there often aren't going to be answers. So that can be a very tough mental process. Disbelief, which we talked about with shock, people can cognitively struggle to accept that the loss has occurred. This is especially present in sudden and traumatic losses where, you lose someone in an accident. There is some kind of wildfire that destroys your home, some kind of natural disaster. You're an immigrant who is being forced out of their country because they're violent unrest. It can just be shocking, like, why is this happening? My reality is suddenly so different, and it can be difficult for our minds to wrap around that, and it can take time to accept, to adjust. Preoccupation. This can be when we may have individuals can have obsessive thoughts about the deceased person or the object of loss, where we're, obsessively thinking about them. And again, remembrance is normal. What does preoccupation mean? I think these are the hard pieces for sometimes different levels of helpers to understand. Of course, we're going to think about what we've lost, but we're talking about when people are really ruminating. So when they may be thinking persistently, repetitively about what was lost, thinking repetitively about one's emotional pain. That can be a common coping style that people have, is just really kind of continually focusing on how much pain they're in, and then it can just continue to kind of deepen that wormhole of darkness. But again, a little bit of a wormhole of darkness is going to be a natural part of grief. The question is, how long should that go on? Again, some individuals can also have obsessive thoughts about how to regain the lost person or object. This can be common in children who may not, depending on what age they are, not totally understanding how this loss has occurred. but this can also happen in adults. And gone on too long, this is something, again, one of those symptoms to pay attention to. This can lead to unhealthy grieving behaviors. If someone is still preoccupied, trying to recapture, obsessively thinking about what was lost, several years later, they're probably going to be having a hard time adjusting to daily life and connecting with those around them in the present because they're sort of stuck in the past. But again, some amount of this is normal and healthy and okay. As we talked about earlier, yearning, that pining for what was lost, missing the comfort of familiarity. And another one that people often don't think about are hallucinations. And these are something that are actually quite common. And again, one person's hallucination is another person's spiritual, existential experience, right? I've heard people who say, there was a bird that showed up and that bird represented my dad, or I saw, a sign in the snow and that represented this person. I am not here to judge if people are seeing things and hearing things that, follow a loss, particularly bereavement, that they are connecting that to some kind of meaning. And this can be connected to spiritual traditions. So again, it's just very important to be culturally competent and to understand what one person may consider hallucination, how does it kind of fit into that person's spiritual and existential framework. Physical sensations. Now, I did post another video that I think does quite a nice job of going into the chemicals that our brain will release when we're experiencing strong grief, how that impacts the body. But again, it's not just an emotional experience. Emotions and loss experiences can create really profound physical experiences. It can exacerbate illnesses. It can be physically uncomfortable, hollowness in the stomach, tightness in the chest, tightness in the throat, feeling very sensitive to noise, to sounds, to lights, feeling kind of a sense of depersonalization, feeling so much that you almost don't feel a part of your body, breathlessness, weakness in the muscles, and lack of energy. And I think as we've talked about some of the emotional and cognitive responses, those make a lot of sense. We are holistic, integrated beings, and we often have physical responses. We have physical responses and we have strong emotional responses. And again, some behavioral responses to grief and loss. And again, I'll say again and again, these can be very normal. Helping professionals just want to look at when this has gone on for so long that person is just really failing to thrive in some way. So sleep disturbances, finding it difficult to fall asleep. You could be overwhelmed with thoughts and feelings related to the loss, particularly soon after. You could wake up suddenly with strong emotions, wake up after difficult dreams related to the loss. It can be hard to eat. You may not physically feel hungry for a while. Some grieving individuals may overeat, a lot can undereat. And as I said, it's more common to have a severe loss of appetite. So if you're around someone that is grieving, it can be really important to check in with them and feed them. This is why, that common example of there being a death in the family and people showing up with food. When my cat died in 2022, I had a very sweet neighbor that made us, a pan of pasta to heat up. And that was really helpful because you don't want to cook. You're exhausted. So, feed those that are grieving around you if they can and see what they're willing to eat. Social withdrawal, again, we talked about that feeling of isolation that people grieving may feel. It can be really normal to want to be alone with one's emotions, to feel like other people aren't going to understand this emotion, that coexisting with that feeling of loneliness. People can also feel really unsupported by their social community. We think about, we're going to continue to talk about kind of cultural reactions to loss, and we don't have a great experience in the United States of talking about grief and affirming grief experiences. So people can feel really unsure of how to present in their community, and it can just be easier to just withdraw. Some people will avoid reminders of what was lost, and some people will seek reminders of what is lost. So for some people, that's I think a lot about after a breakup. I'm going to avoid places we went together. I'm going to cut off friends that we used to share. I'm going to, stop playing pickleball because that's what I used to do with my girlfriend. Whereas other people, they want to seek out those reminders. Keeping sacred objects. The child holding on to the t-shirt. The widow making a quilt out of their, partner's various clothing. Visiting places, engaging in activities that are connected to what was lost. Those can both be normal reactions. And it makes me think of the song by Naked Eyes, Always Something There to Remind Me, which is like an 80s song about everywhere they go, they're reminded of this old relationship because everything reminds them of that world they have with their loved one. So we've talked about some of the common responses, some of the common effects of going through a loss experience and what grieving can really feel like, how it can impact us, and, just kind of pulling back. People are going to have different experiences, different combinations of effects, of symptoms, but it can be quite like going through a maze. You're suddenly lost. You don't know which way to turn. You can feel like a fish out of water. You can feel disoriented. I think about Alice falling down the rabbit hole, where the world is just suddenly a new place. It can often be quite scary. There can certainly be moments that feel positive, but it can be extremely disorienting to go through a significant grief experience, and it can take time for people to find their footing again, to find their sense of direction again. And this is where, we want to lead to this question of, again, when is grieving something that we should just respect, gently support, and when is it something that someone may benefit from a little bit more professional care and involvement? So I want to quickly kind of talk about how we conceptualize grief and related issues that pop up, and when could a professional, need to get involved, as defined by the current, body of evidence by mental health professionals. So first we want to talk about grief and depression. Now, again, there have been a lot of debates through the decades about, can depression and grief coexist? When should we start looking for that? In the DSM, it used to say, that within like a month or 6 weeks, you should not consider depression. And there were a lot of people who said, no, like some people are going to be depressed as soon as they are grieving. Some people may already experience depression, maybe already be predisposed to depression. As a result of that, they're going to have some of those depressive symptoms which are going to be separate from grief. But again, it's so complicated, it's going to be very case-by-case basis. Grief can lead to depression. Depression for some people may already be present, particularly people who were already depressed and then experienced a loss. But grief can also mimic depression, and this is something that I got quite frustrated with when I was working in cancer care. Not just the mimicking depression, but can be misunderstood as depression. There were just so many doctors that were passing out Xanax to my clients, their oncologists or general care providers, because when the clients were talking about their experience of losses, their sadness at, the abilities that they lost, at how stressed it was, going through treatment, doctors would often assume that was depression. So there can be a lack of professional recognition of the difference of grief and depression. And so that's why I want to talk about that a bit today. What are some of those differences look like? And people can overly respond and diagnose grief as depression, but again, they can coexist. So what do we really need to know? And again, I can just give you basics, but you still need to really kind of understand your clients, understand the people that you are working with. Grief is going to have painful feelings. Depression often comes with painful feelings, but as Worden pointed out, one key difference can be your sense of kind of self-esteem and how you talk to yourself. Usually after a certain period of time, those questions of self-blame, of questioning, kind of alleviate as people accept that the loss has happened, and their self-esteem is usually maintained. Whereas depression, that's when it can start to turn into, I am worthless, I have a sense of self-loathing. Whereas, grief, it can come with those feelings of, negative emotions, not enjoying life, not being as engaged. But grief is often going to have kind of a cycle. It's going to come in waves. So there might be times that the person is feeling a little bit more okay. They may be able to be in a place where they have positive memories of what they've lost, where they're remembering, they're appreciating. They're not always going to be stuck in those painful moments. But boy, will there be painful moments. But again, grief can often be thought of as just a bunch of waves crashing over you. Whereas depression, it's going to be more consistent. That most of the time, for long periods of time, you're going to have those negative feelings. So again, I think it's helpful to wait a couple weeks, to wait a month before, if you're a professional looking at depression when someone's grieving experience. But however, it depends on that person's background. One thing you always want to pay attention to, though, is if there's any kind of suicidal ideation. Moderate to high risk suicidal ideation is usually linked with depression and should always be taken seriously. So those are some main differences. Again, grief feelings over time, which again can be several months, but that can be years. There are going to be waves of emotion. Where depression, you're more consistently in that low state. In grief, after a certain amount of time, you usually have a sense of self-esteem. You can appreciate the thing that was lost. In depression, you feel worthless, you feel self-loathing. But any time that suicidal ideation pops up, you need to pay attention to that. And then a big update from March 22 is the, as I previously talked about last week, is the addition of prolonged grief disorder to the Diagnostic Statistical Manual version 5. So, grief has shown up in the DSM through the different iterations, and we've called it different things, complex grief, complex bereavement, persistent complex bereavement. But now we have this term prolonged grief disorder. But as you're reading different things, you may see the term complex grief. That is, they've kind of changed that language here to call it prolonged grief disorder. Why? A part of that is understanding that, again, grief is a normal experience, but we want to start looking at this as an issue that could deserve, additional treatment when it's gone on for a really long time and when there is just very severe disruption to daily functioning. So the timeline now is adults that have been severely bereaved for 12 months or more, or 6 months for children and adolescents. And again, I think this is, helpful that we're conceptualizing when do people maybe need a little extra support with the grieving experience. But I've known plenty of adults that have these responses, and it's not just with bereavement, the loss of a relationship, etc. But again, in prolonged grief disorder, the bereaved individual may experience intense longings for the deceased, or preoccupation with thoughts of the deceased, or in children and adolescents with the circumstances around the death. And as we talk about children, they can, again, sometimes become more preoccupied with the circumstances rather than what was lost. And these grief reactions have to occur most of the day, nearly every day for at least a month, but again, past that window of either a year for adults or 6 months for children. And the individual has to experience clinically significant stress or problems performing daily activities at home, work, and other important areas, and it affects everyday functioning in a way that typical grieving does not. Now, I think a huge issue here with this diagnosis is, again, I don't think that a lot of health and human services professionals, or really a lot of people, deeply understand what typical grieving looks like. We do tend to avoid it. So this is, in my opinion, this can be a very useful diagnosis if you have someone that actually understands how messy and painful grief can be and what it tends to look like. But for people who don't, they're just going to be very quick to slap on this diagnosis. So I think, again, it's very important that we can accept and understand that grief is messy, it is powerful, but when a person is going on for, again, an adult for a year, and they're just not able to engage with home tasks, they're not able to socialize, similar to how we think about, substance use. Substance use is an issue when it gets in the way of living life in a functional and healthy and life-giving way. When someone is completely kind of cut off from the rest of their life and just not thriving, that, and meets these criteria, that's when it might be worthy of a diagnosis and specialized treatment. And again, here are some of those symptoms: identity disruption, feeling as though part of oneself has died. And again, that is a normal grief experience, but it's when it's taken to an nth degree and you just feel completely, again, in some ways dead to the world. A marked sense of disbelief about the death, someone who's just really not able to accept that. Avoidance of reminders that a person is dead. Intense emotional pain, difficulty moving on with life, emotional numbness, feeling that life is meaningless, intense loneliness. And in the case of prolonged grief disorder, the duration of the person's bereavement exceeds expected social, cultural, and religious norms, and the symptoms are not better explained by another mental health disorder. Again, when we look at these symptoms, these are all symptoms that we just talked about, that these are very normal grief responses. So it's just going to be really important that providers giving this diagnosis understand that it is about the intensity, it's about the amount of time, because someone who's experienced a fresh loss is going to have probably a lot of these responses. It's, has this gone on? Have they not adapted? Have they not, as Worden said, adapted to that loss, found some amount of new normal? In grief, we may experience pain for the rest of our lives. But, I think about that, there should be a screensaver where, something would kind of float around the screen and you'd kind of be waiting for it to edge of the screen. In grief, that box starts out as much more narrow and you're going to feel that pinging around. And with time, healthy grief where it should be, where it just takes longer to feel that. You feel it less and less often. You may still feel those extreme feelings sometimes, but it's not going to be as often because you have adapted. So I think there are a lot of benefits here that people who are experiencing really debilitating grief through this diagnosis can get treatment. They can get billed through insurance, but there are also a lot of concerns about health providers not really understanding the criteria of grief because they've not traditionally done a great job. There are concerns about overprescriptions of medications because, medication companies love to jump on the bandwagon of anything that is considered a mental health disorder. And there are certainly times and places that is helpful, but I'm just not sure that everyone who's experiencing grief needs to be filled with Xanax. So, there are pros and cons, and I encourage you, if this interests you, to kind of look at the different debates and literature. There have been some really excellent articles about this diagnosis in the New York Times and the Washington Post. And again, another piece I want to bring your attention to is, exceeds expected social, cultural, and religious norms. So in one sense, we want to be sensitive to someone's cultural background, and in some cultures, it may be very normal to outwardly grieve in very intense ways for very long periods of time. But also, I think in other cultures, you may be expected to just get over it. So complicated questions, complicated topics, but, grief is a very confusing experience. It can be like being lost in a maze. And I hope that, this reading and this conversation gives you a little bit more insight in understanding other people's grief responses and your own, and also starting to try and differentiate, again, when is this something that someone may need additional support, but also understanding that life is hard and grief is a part of it. That's all for this week. I have several other videos. Take care.